Last week was it was our highest week yet, where we delivered over 427,000 doses of vaccines across the province. And I just want to express my gratitude and thanks for all of our teams working at clinics across BC. And to thank everyone, I had the opportunity of visiting clinics in Kelowna and Prince George, and just to the amazing work that's being done across the province. So thank you for that. In terms of the number of cases that we've had here in British Columbia over the last 3 periods, from Friday to Saturday, we had 57 new cases. Saturday to Sunday, an additional 50 new people diagnosed with COVID-19. And in the last 24 hours, 38 new cases across the province. So that is 145 new cases across BC. Our total, however, is only up 130 or so. There was a bit of a data correction that had overcounted some cases. So our total number of people diagnosed with COVID-19 is 147,549 in British Columbia. Of the new cases, 48 were in Vancouver Coastal Health Region, 68 were people who live in the Fraser Health Region, 1 was a case on Vancouver Island, and 26 were in Interior Health. We currently have 930 active cases, 107 of whom are in hospital, 37 in critical care or ICU, and 144,848 people have recovered from COVID-19. Sadly, over this weekend, we have had 5 additional people who have died from COVID-19 in British Columbia, bringing that total to 1,754 people that we've lost. One of the people who passed away this past weekend was a person in their 20s. One was a person in their 60s, and 3 were seniors in their 70s. And our condolences go to all of those who have lost loved ones through this time. Our thoughts are with you, even as we are moving through this pandemic phase. We have 1 new outbreak to report as well at Surrey Memorial Hospital, leaving us with 3 active outbreaks in long-term care and assisted living and 2 in acute care. I now want to give an update on some of the data that we've been following so closely over the last number of months, as we are looking to hopefully go later this week to the next step in our restart plan, to give people an idea of where we've been and how we are, what we're looking like going forward. So this is the geographic distribution of cases by local health area, by the residents of cases from the week in May, a month ago, to what we're seeing today, or in this past week. And it's really gratifying to see not only light color yellow in many, many places in the province, but that white, which indicates that in many communities across BC, there were no cases in the past week. And that shows us that transmission has decreased. And we see particularly in the Lower Mainland, where we've had high rates of cases for many, many months, they have now dropped dramatically. And there's a few small areas where there are still clusters of cases, again related to pockets where there has still lower immunization rates in many cases. If we look at our dot plots that we've been following by local health area, CHSA, it helps us get an understanding of where transmission is happening, and this is case counts. And we can see that Surrey still remains the top of our case count. However, when we look at the scale on the left-hand side, not only has it decreased, but about the last time we presented, a little under a month ago, the scale was up in the 300s per day, and per week, and we're now down at 70 cases per week, being the highest in the Surrey area. And as you can see, the light color of the blue dots across the board reflecting the protection that we're getting from immunization and the decreased transmission in communities. And this remains the same if we look at the rates of cases per 100,000 population by local health area. It's really gratifying to see all of the local health areas in the Fraser Health Region are now down amongst the lowest. And we have a few small areas where cases have popped up. And we know that in Invermere, for example, or Windermere, case rates can go up with very small numbers in small populations, and this reflects a cluster in that community that is now being managed by public health. So this overall is our epidemic curve, showing the daily cases on the top line and the dramatic fall that we have seen in cases as we started to get critical mass of immunizations in the population across BC. And lagging that, but also decreasing, is hospitalizations. And another thing that is important when we look at this is the deaths that we've seen in British Columbia. We had that increase with the second wave, but the fact that it has stayed low, despite the increasing cases that we saw during our third wave, reflects the ongoing and durable protection from immunization, and particularly the protection that we see in long-term care and our seniors and elders, who we prioritize for protection with vaccines. And this is something that we look at carefully. We've been watching the vaccine effectiveness over time, and I have some more data on that to see if we see a waning of protection. And the good news is we're not seeing that. That tells us that even with a single dose of vaccine, we're seeing strong, long-lasting protection from severe illness and, importantly, from death. And we see this across the board. This is the epidemic curve by local health, by regional health authority, and it really shows the picture of slightly different experiences of the pandemic across the province, with the lower mainland having the highest peaks, of course, but having sustained high levels of transmission in the north for many, many months starting in December, and really that dramatic decrease once community immunization started in earnest in the north. So really gratifying to see that decrease across the board in all health authorities. And we see the same thing with age groups. The bottom purple line, again, reflects the power of the vaccines that we have, where people over age 80, in that purple line, had sustained low rates of disease even when we were at the peak of the third wave. And we see progressively the age groups coming down as vaccination spread. This is looking at our test positivity rate across the province and our testing rate, and what we can see is the testing rates still remain high across the province, but the percent positivity has dropped, and it's even lower today than it has been up until the end of last week. But it is reflection again of the decreasing risk of transmission in community. We do know, however, that by age, older people still bear the brunt of the severe illness and deaths. And we see this in hospitalization, which has come down, but still is highest in people who are older, and same with people who have died from COVID-19. One of the things that we've been watching very carefully to see if we are at that place where we can move on, and of course where we have seen resurgences of disease in other countries, and certainly the UK, where we've seen increase again in transmission, particularly in people who are non-immunized, is looking at our variants of concern. And as we can see across the board, the variants of concern make up about 80%, the vast majority of our cases across the province in all health authorities. So we know that once people, that these strains are more transmissible, but we also can see that despite the fact that these more transmissible strains are causing illness, the measures that we have taken, both immunization and also good public health follow-up, that bread and butter work that we do in public health every day, means that case numbers have come down regardless of what strain of the virus people are infected with. And that's going to be important for us as we go through the summer and into the fall, making sure that we continue to have those good, strong, basic public health programs to manage cases and to prevent transmission from growing. We also can see that even with the newer strains that are more transmissible, we're not getting those widespread explosive outbreaks that we saw even a few months ago. So that is good news for us. What we have seen is that there has been a slight change in the proportion of different variants that are causing illness here in BC. And this is, they all add up to 100%, but we can see for the last week, we continue to have the majority of the cases that we're seeing infected with the alpha strain, which is the one that was primarily detected in the UK, and also the P1 or the gamma strain variant, which is about 40% of the cases that we're seeing. The Delta has bounced around a little bit. It's now about 12% last week, but we have to remember that's a much smaller number than it was even a few weeks ago. So we are seeing good protection and good decrease in transmission from the actions that we're taking through public health and through immunization again. In terms of our immunization progress, this is our population pyramid on the left, which shows you by age group, people who have received first doses and second doses in green. And it really is remarkable how people across the province in all age groups have stepped up to be immunized. And we know that second doses are now increasing as well. So we're at, as of when this slide was made last week, end of last week, we're about 76% with dose 1 and over 25% of people have received dose 2. We do see some variation by health authority where we're more challenged in some communities, particularly across the north, which is a huge geographic area with many small communities, getting out there and getting people immunized, making sure they have access to vaccine in a way that's convenient for people. And we're seeing lots of new strategies across the north and interior in particular, but across the province to make sure people have access to vaccine when they're ready. This shows the same information by the trajectory of how we were able to provide immunization by age group. And as you can see, for every age group, it goes up rapidly. But as younger people were immunized, that leveled off a little sooner in each successive age groups. We're now at the point where we're starting to see a little bit of leveling off in the 12 to 19-year-olds. And so now's the time to focus our attention on making sure as we go into summer we're protecting young people so that they can take full advantage of the opportunities for the summer and are protected going back to school in the fall. If we look geographically, we are seeing this is vaccine coverage in 12 and up. We see that it is high across the board. The lowest, the lightest color green reflects at least 50% of people 12 and up being immunized with dose 1. And we can see there are still some pockets where we have work to do, but it's very gratifying to see over 80% in many areas of the province. And I know we're working hard to get everybody up there too. And if we look again at the local health area with people age 50 and over, that's even more positive, where we're above 80% in many parts of the province, particularly in the lower mainland, some of the areas where we've had that most dramatic impact of the virus in communities. We have been watching carefully around breakthrough cases, and these are challenging to measure. But as more people are immunized, the number of people who are infected, who are vaccinated, is likely to go up because most people who have been exposed to the virus will have been immunized, and it's not 100% protective in everybody. So we have seen about a 2% rate of breakthrough infection over time, but still the risk in people who are immunized is dramatically lower than the rate in those who are non-vaccinated. And this is reflected in this slide, where we see as the rates are coming down across the board, they are considerably lower in people who are immunized than non-immunized. This is a little bit more complicated, but it shows the same thing. By breaking down the rates of infection by the different variants. As you know, we're doing whole genome sequencing on all cases now, so we have a good sense of what strains of the virus are circulating. And for all of the strains that we see circulating in BC, the rate of infection in people who've been immunized is much, much smaller than those who have not yet been immunized. And what we are moving to is a better way of understanding the protective effect of immunization in the population. And we presented, prior to moving to step 2, this same vaccine effectiveness data for people who are 70 and over. And we are now at the point where we can measure that same thing in people in the 50 to 69 year age group. And this is using a very sophisticated test negative design that was developed by the BC CDC, especially Dr. Skowronski, over the last number of years to look at influenza. And we now have the ability with the team at BC CDC to look at how well these vaccines are protecting us on a real-world basis here in BC, despite the different variants that are circulating during this period of time. And you can see the breakdown on the people. There are about 60,000 people that we were able to link their immunization status and case status and look at how well the vaccine is protecting. And what this shows us is that immunization is preventing 7 out of 10 infections across the province. So we have overall a 70% vaccine effectiveness. And this is really good news. It tells us that these vaccines are working in all age groups, and we have the information from the 70 and over a longer period of time that protection is lasting and is durable. I also wanted to, this is a slide that shows an update of the seroprevalence studies that we've been doing since the very beginning. And we've done these, and this is now the 5th sample that we've taken. It's a cross-section of people in the community to look at different age groups to look for antibodies for the virus. And early on, we had less than 1% of people who had antibodies to to SARS-CoV in March of 2020. And this remained relatively stable through to September. It increased a little bit in the study that we did in January of 2021. It went up to about just under 5% of people had antibodies. And now what we're seeing, so we can measure antibodies that are protective from immunization and also from infection. And we can tease those apart, and that work is still ongoing. But these are the preliminary results from the study that was done, the seroprevalence samples that were taken in June, that show that now about 50% of the population in BC at different age groups have antibodies to this virus. And the vast majority of them are protective through immunization. So this is a really great way of measuring, helping us understand the level of protection in the population through antibody levels. So where does this leave us now? We'll go back to our model that we've been using as a guide, as a way of trying to understand the types of infectious contacts we've been having and what we call the reproductive rate over time. And what we can see is we now have a sustained low reproductive rate. That means that for most people who are infected, they are not passing this virus on to anybody else. And that's how the pandemic will fizzle out over time, as long as we continue to not have infectious contacts, to do the things that we need to do to prevent transmission. And it really reflects, I was talking with my colleagues in the north and the interior, when we have clusters of cases now, instead of that being spread widely, it is people who we are known contacts of cases. So when they become infected, they're already being isolated. So in that way, they no longer pass it on to anyone else. And that's how we come out of this pandemic. And if we look at the modeling that shows the potential that could happen as we continue to increase our social contacts, as we return to those things that we need so much, whether it's work or the social interactions that we've been missing for so long, we will expect to see some cases again, and some clusters, and some transmission in certain situations. But it's not likely that we're going to see that rapid increase in spread in the community the way we did even in March. And that's because we know we have a solid base of protection through immunization, and we have a strong public health program to follow up in each of the cases and clusters as they occur. So this is where we are now and what we're looking at to be to make those determinations of how we can move into step 3 later this week. So we do need to remember that this is predicated on us doing everything we can to get immunization as high as it can be, and our case rates as low as possible. And that is what is going to get us through this summer and allow us to get our lives and back and to have those connections that we need. It's also what is important for us to have ongoing protection, because there are still unknowns about what's going to happen as we move into the fall. So we'll need to continue to watch carefully, but we know that these vaccines are providing incredibly good protection. And to make this a summer we all can enjoy, we need to make sure that as many people as possible are protected, and then we'll monitor to make sure that this protection is long-lasting. So I encourage everyone to start the summer off right. Ensure your children are vaccinated when they're eligible before you take your summer holidays. And if you're going to be traveling, encourage and help family members near and far to do the same. And book your second appointment when you're eligible. Our progress through this pandemic has been here in BC the result of us all working together against a common foe, supporting each other with compassion, even as things changed, even as sometimes it was unclear what was going to happen next. And we learned a lot as we went through this last 18 months. But we have and continue to have to do our part to get through this extremely challenging time and put the pandemic behind us for good. We need to know that this virus is going to be here, but it's not going to be in a way that's disrupting our lives like it has for the last 18 months. And as we bridge to these brighter days of summer, let's make this a summer of hope and rejuvenation for all of us. We need to continue to get our vaccines to make sure that we're best protected, both for ourselves, for our family, and for our communities, and continue to use our layers of protection in those times when it's risky. I also want to just make a few notes about, we know how challenging it is in these last few days with the extremely hot weather across the province right now. And importantly, from a health perspective, the temperatures are staying high at night. That means we don't get that reprieve, and indoor air temperatures increase during the day, and particularly in places that don't have air conditioning. So it's like this, conditions like this that make people most at risk. So even when temperatures come down, hopefully on Tuesday and Wednesday this week, they will still be high and people will still be affected by them. If you don't have air conditioning, close your windows in the morning before the temperature outside gets hotter than the temperature inside. That helps keep the cooler air inside. Close your blinds as well, and curtains and shutters to keep the sun out. Open windows at night when the temperature outside gets cooler than the temperature inside. And things like pointing fans outside the window. Also important to drink plenty of fluids, to wear light-colored clothing, to not go out and exercise and work in the heat of the day, and to take care of yourself and look in on your neighbors and those around you. We've shown through this pandemic that we care about our communities and the people that are in our communities, and this is an important time as well to check on those who are not as mobile, who are elderly, to make sure that they have access to water, to make sure that they can cool themselves down with a cool face cloth and things like that. I know that this has been just another challenge that we are dealing with, but we can come together and support each other through this as well. And let's also, of course, remember to be kind, to be calm, and to be safe.